Hello students, welcome to EduPharm. Believe and become. Please like and share the video and subscribe to our channel. Hit the bell icon to never miss any update. Hello students, here we have a compilation of all the test yourself question only for your convenience. Each set of 100 questions from test yourself is only for 100 rupees, all in a PDF format. We have got you an offer of 2 question set just for 180 rupees. To avail this offer, you just need to contact us through the mail, and the mail address is edufarm1994@gmail.com. Contact now to avail this offer. Hello students, welcome again to the new segment of EduPharm. This lecture is the continuation of the factors affecting drug absorption. In previous lectures, we have discussed physicochemical and pharmaceutical factors affecting absorption of drugs. Today's lecture is about the patient-related factors. So, some of the patient-related factors are age, gastric emptying time, blood flow through the GIT, GI contents, GI pH, intestinal transit time, and pre-systemic metabolism. Before dealing with the patient-related factors influencing bioavailability as well as absorption of drug, let's take a quick look to the anatomy and physiology of the GI tract. Three major components of the gastrointestinal tract are stomach, small intestine, and large intestine. Small intestine includes the duodenum, jejunum, and ileum. The biological environment like pH and the area of membrane available for absorption in each of the segments is quite different. When an oral dosage form is swallowed by a patient, it travels through the gastrointestinal tract. During the passage, the dosage form encounters great anatomical and physiological variation. In infants, the gastrointestinal pH is high and intestinal surface and blood flow to the GIT is low, which results in altered pattern in comparison to adults. In elderly persons, causes of impaired drug absorption include altered gastric emptying, decreased intestinal surface area, and gastrointestinal blood flow, higher incidence of achlorhydria and bacterial overgrowth in small intestine. After oral administration of drugs, it rapidly reaches the stomach and eventually stomach empties its contents into the small intestine. Delayed gastric emptying can seriously delay the onset of therapeutic effect of drugs. Gastric emptying is also significant in the absorption of drugs that are unstable in the stomach because of the low pH or enzyme activity. Penicillin is unstable in acid and decompose if stomach emptying is delayed, whereas aspirin may irritate the gastric mucosa during prolonged contact. The next factor is blood flow to gastrointestinal tract. Once the drug is absorbed from the small intestine, it enters to the hepatic portal vein and the liver via mesenteric vessel before it reaches the systemic circulation. The blood perfusing the GI tract plays a critical role in drug absorption by continuously maintaining the concentration gradient across the epithelial membrane. Any decrease in mesenteric blood flow will decrease the rate of drug removal from the intestinal tract, thereby reducing the rate of drug bioavailability as well as absorption. Then GI contents. Presence of food in GI tract can affect the bioavailability of the drug administered through oral route. Digested food contains amino acid, fatty acids, and other nutrients that may affect intestinal pH and solubility of drugs. Effect of food on the bioavailability of a drug from our drug products include delay in gastric emptying, stimulation of bile flow, change in pH of GI tract, a physical or chemical interaction of the meal with the drug product or drug substance. Absorption of antibiotics like penicillin and tetracycline is decreased with food, whereas grisophulbine and metazolone are better absorbed when given with food. Gastrointestinal pH. Gastrointestinal fluid pH influences the drug absorption in several ways. One of is disintegration. Disintegration of some dosage form is pH sensitive. With enteric coated formulations, the coat dissolves only in the intestine, followed by disintegration of the tablet. Another one is dissolution. A large number of drugs are either weak acid or weak bases whose solubility is greatly affected by pH. A pH that favors formation of salt of the drug enhances the dissolution of drug. Weakly acidic drug dissolve rapidly in alkaline pH of the intestine, whereas basic drugs dissolve in the acidic pH of the stomach. And then the absorption. So depending upon the drug pKa and whether it's an acidic or basic drug, the gastrointestinal pH influences drug absorption by determining the amount of drug that would exist in unionized form at the site of absorption. Stability is the other way where a gastrointestinal pH influences the chemical stability of drug. Acidic stomach pH affects degradation of penicillin G and erythromycin. With basic drugs, formation of insoluble drug hydroxide in the alkaline pH of the intestine has been observed. Another factor is intestinal transit. Since small intestine is the major site of absorption of most of the drugs, intestinal transit time is desirable for complete drug absorption. Peristaltic contraction promotes drug absorption by increasing the drug membrane contact and by enhancing dissolution, especially of poorly soluble drugs. Intestinal transit is influenced by food, disease, and drugs. One example is metoclopramide, which promotes intestinal transit and thus enhance absorption of rapidly soluble drugs, while anticholinergic retards intestinal transit and promotes the absorption of poorly soluble drugs. Intestinal motility also influences drug absorption. Normal peristaltic movements mix the contents of the duodenum, bringing the drug particles into intimate contact with the intestinal mucosal cells. The drug must have a sufficient time at the absorption site for optimum absorption. In case of high motility in the intestinal tract, as in diarrhea, the drug has a very brief residence time and less opportunity for adequate absorption. And finally, pre-systemic metabolism, which also affect the absorption of drugs. For a drug administered orally, two main reasons for its decreased bioavailability are decreased absorption, and first pass or pre-systemic metabolism. Before a drug reaches blood circulation, it has to pass for the first time through organs of elimination, namely the gastrointestinal tract and the liver. The loss of drug through biotransformation by such eliminating organs during its passage to systemic circulation is called as pre-systemic metabolism or first pass effects. The diminished drug concentration or rarely complete absence of the drug in plasma after oral administered is indicative of first pass effect. Four primary systems which affect pre-systemic metabolism of a drug are luminal enzymes, gut wall or mucosal enzymes, bacterial enzymes, and hepatic enzymes. So that's all for today. Check out more of our videos. Feel free to ask any question about the video, and also you can suggest the topic for our next video. You can also support us. For details, check the description box below. Your support will encourage us for making such videos. Thanks for watching. Hope to see you in our next segment. Till then, keep your preparation on and stay tuned with EduPharm.